When's the right time for a knee replacement? So you have knee pain that's getting in the way of living your life. How do you know when it's time to get that knee replaced? I'm Dr. Gina, a physical therapist who's also recently had a total knee replacement myself. According to the American Academy of Orthopedic Surgeons, close to 1 million people each year have a total knee replacement. That number is estimated to triple by the year 2030. Reasons for this include that people who are in their 50s and even 40s are electing to have the surgery. Over the years, I've been fortunate to work with folks with total knees in the hospital right after surgery, in their homes during the early stages of their recovery, and in the outpatient clinic setting. I've now seen this surgery from both sides of the fence as a PT and now as a patient. In my own life, I've come to see that deciding when to have this major surgery is not clear-cut at all. Over the past 2 years, I saw a steady decline in what I was able to do. It was because of the pain that I had in both my knees. Now, when I describe pain, what I mean is pain in my knees themselves. I'm not talking about your usual muscle soreness you get a day or two after a hard workout. I'm describing sharp joint pain, achiness, and swelling that made it harder to do stuff. Before that, I was able to carry a treatment table up and down steps into someone's home for my job, seeing patients. I was able to carry a laundry basket from the basement to our upstairs bedroom. I was also working out by running on the elliptical, rowing on a machine, lifting weights, doing yoga, cycling up to 20 miles at a time, and hiking for about an hour several times a week. Now, the first thing I noticed was going up and down stairs became really painful. For a while, I could get by holding the handrail, but in a couple of months, I realized I needed to prescribe myself a cane to help me get up and down stairs. The next thing I noticed was hiking became more difficult. In fact, my husband and I went to our usual park to do a hike. I lasted only 15 minutes before the sharp pain in my knees made me stop. I had trouble getting into our car, then I had pain and swelling that didn't go away. And it went like that. Normally, I would have clicking and popping in my knees. As long as it didn't hurt, it's not normally an issue. But the difference now was if I tweaked either knee while doing something, it would get swollen and just be really angry. I was doing less and less. I stopped my hobbies. My work as a PT was suffering as well because I couldn't demonstrate some of the exercises. I had trouble schlepping a table around. Now I was taking a cane with me in my car just in case I had to go up and down stairs. I even had to pass on going to concerts, which I love. I was in a vicious cycle where I was doing less and moving less as a result of more pain, which then led to doing less. You might be wondering what sort of treatments I was using. Treatments that had worked in the past weren't as effective or had stopped. I was doing the ice, doing the ibuprofen. I was in physical therapy at my buddy John's clinic. We would make some progress, but then the knees would get swollen and angry again. I tried steroid injections. As long as you get injections infrequently, it doesn't accelerate the arthritis, according to my physician. I had the x-rays and MRIs. It was progressing to the place where it affected, how I walked. I couldn't straighten or bend my legs normally. I was starting to get desperate. Here's my final straw. I took a trip to New York. I was really excited because I was meeting up with a couple of friends. I had tickets to see Stephen Colbert. As soon as I walked off the plane into the terminal, there was an unsettling clunk in my left knee. It immediately hurt. I managed to hobble to my Uber and get checked into my hotel. Then the first thing I had to do in the city was buy a cane because I was near Central Park and I was determined not to be trapped in my hotel room. It just sucked, and I didn't get to do nearly as much as I would have liked. Once I got back home, it was my buddy John, who does my PT, who brought up what I didn't want to hear, that knee replacement was on the table. It actually took me about a month to come to terms with making that decision. I was actually on a cruise a month after where I couldn't even get ashore to do the hiking that I wanted to. I realized if a patient came to me in that much pain and told me they weren't able to do the things they liked, it was not okay. To sum up, the decision you make about whether or not to get a knee replacement is going to be personal. You'll be speaking with your physical therapist, your physician, your orthopedic surgeon, and maybe others about this. It'll come down to how much smaller your life is becoming. Thanks for watching, everyone. Cut.